The pelvic floor is a group of muscles and connective tissues that stretch like a hammock at the base of your pelvis. These muscles play a very crucial role in supporting your pelvic organs, maintaining bladder and bowel control, and even contributing to sexual function. So when there is too much tension or tightness in these muscles, it can lead to discomfort, pain, or sexual dysfunction. One effective tool that addresses this is the pelvic wand. For your homework, you can use this pelvic wand and allow the targeted areas of muscle tension and tightness internally to relax, similarly how you would lay in a foam roller to address the muscles in your body. You can start by finding a comfortable private position and ensure you're relaxed. Insert the wand gently into the vaginal or rectal canal depending on where you're targeting, slowly and mindfully addressing gentle pressure to areas that feel tender or tight. Remember to breathe deeply and move slowly. You're not forcing muscles to release. You're encouraging them to relax. So with consistent use, this pelvic wand can help release trigger points, decrease pelvic pain, and restore normal muscle function, essentially improving your overall pelvic health and quality of life. So who wouldn't want that, right? A good starting point, just to reiterate, for this is to lay down in bed, semi-reclined, pillows propped under the head and upper back with your knees. So lubricate the wand, the tip with either KY jelly or something similar. You always want to wash it with hot soapy water before and after, moving the wand gently and slowly, inserting the wand into the vaginal canal. You never want to go straight up and in. You don't want to hit the cervix, so the wand should not be inserted more than 3 inches. Okay, into soft tissue. Soft tissue should feel pliable and when relaxed. If it's hard or tender to touch, that's an area that needs work. So simply maintain gentle, sustained pressure in an area of a restriction for 3 to 5 minutes until it softens and is more tender. So once that soft tissue restriction is applied for 3 to 5 minutes, it should feel more pliable and relaxed. You always want to check with your pelvic floor specialist for specific recommendations for your home pelvic floor program. I urge you not to just get one of these wands and start releasing your pelvic floor. You always want to have some sort of guidance on what's going on here in the pelvic floor, vaginal canal, and rectal space as well. Remember, both parts are making up this pelvic floor. Actually, every single muscle of your pelvic floor does attach to the tailbone. So rectal release work with this smaller end is very, very helpful and profound in helping you sit with more ease, feel more movement and pliability and motion in your hips, having less back pain, less sacral pain, less locking in your SI joint in general. So I can't recommend rectal work enough. Again, just to reiterate, never going straight into the vaginal canal, always going in on a bit of an angle. Never going more than 3 inches. A lot of times you can get a lot done with just a couple inches or even 1.5 inch right around the brim of the pubic bone, right there into that superficial pelvic floor. So when you're going in there, just sustained soft pressure. You don't need to force. If you've had pelvic floor work done before, it's going to feel like a very different amount of pressure. Your pelvic floor therapist is skin on skin, sort of obviously with a gloved finger, but it's more direct contact, right? The proprioception is there. You're using a tool, which is a little bit harder to feel your own soft tissue. So I can't stress this enough. Don't force. Don't feel like you have to, bully your way through. You want to make sure that your body is not having to brace against this pressure. If you notice you're tensing or tightening, come back to your breath, soften in, make sure you're taking some deep, relaxing breaths through your diaphragm, and also be curious about it. Compare side to side and see how you do. A good rule of thumb is to try to do this every couple of days. It doesn't have to be every single day, but either every other day or every couple of days, and then see how you do.